Good morning, good morning. I am excited to be here. My name is Laurie Stolen. I'm the Director for Larimer County Behavioral Health Services, and I'm going to be moderating the next panel that we're going to have this morning. And so if I could possibly have our panelists, we've got Mr. Paul Hooten, and we've got Terrell Keith, and Misty Perry, and Becky Wyperd to come up to be on our panel, that would be wonderful. As they're making their way up, let me just say a few things, and then I'm going to turn it over to them to spend some time talking a little bit about their why and the work that they do and why they chose their work. The intention is for us to bring a variety of folks together to talk about their careers in behavioral health, about their passion and their pathway to the career in which they find themselves today. So I would love to have you have some microphones here, and we'll pass them down. And let's start on this end with Paul. And talk to us a little bit as you go down the line about your career pathway, your background, kind of how you chose your line of work. If this isn't the first position that you've had in the behavioral health field, sort of talk about how you've navigated your round and if there were people that were influential in your life about helping you get to where you are today. And then after we do that introduction, take 5 or 6 minutes to talk, each one of you, and then we're going to go into some questions, and hopefully that might generate some further questions from folks out in the audience today. So I'll turn it over to you, Paul, to start, and thank you all very much for being here today.
All right. Thank you.
Might have to. I am not an IT expert, so let's just see if we can get the microphones going here. Calling all helpers.
Hello?
The little green light's on. Oh, I hear something. Uh-huh.
Hello?
Hello,
This-
hello, hello, hello.
Yep.
Take that one. Thank you. Hi there. My name's Paul Hooten. I am an LPC. I got my bachelor's in psychology at Point Loma out in San Diego. And then I came back to Colorado. And I did some random odd jobs that had nothing to do with behavioral health for a little while, like making bagels. And eventually I went back to get my master's at UNC in Greeley. And while I was doing that, I began working in long-term care facilities doing social services work, which was a good experience in terms of getting to work with older adults, specifically older adults sometimes with significant mental health issues or dementia, so that was a lot of valuable experience. Once I finished my master's, I transitioned into, through my internship, working with court-ordered clients who had committed violent crimes, mostly domestic violence and sex offenses, doing evaluations for the courts, and doing intensive counseling with the people who were court-ordered to do the counseling. That's obviously pretty difficult work, and it takes a lot of stamina out of you pretty quick, and so eventually I was ready to move on from that. I had a friend who I had previously worked with at this same job who had moved on to crisis work and was working in the emergency department at North Colorado Medical Center. And so she thought that would be a good fit for me. I was interested in doing that kind of work. I'd already got quite a bit of experience working in my previous job with pretty intense situations, and I thought that would sounded interesting to me. So it turned out it was a very good fit. I liked working in crisis in the emergency department because it was different every day, because it was and is extreme situations where people need help and where extreme situations are going on that are a very real danger to people themselves and sometimes the community. And so I have now been working there for over 12 years. And I've been supervising the crisis intake and assessment team for Banner North Colorado Medical Center, Banner McKee Medical Center, and Banner Fort Collins Medical Center for about 5 years now. Did I cover it?
I think so. I think that's great. Yeah, I
All right.
appreciate you giving the background. Thank you.
Yeah.
Hello, everybody. My name is Terrell Keith, and I am a certified peer and family support specialist, as well as an addictions recovery coach. I've been in the behavioral health field for about 2.5 years now. I started over at an organization called Homeward Alliance, based out of the Murphy Center. That was my first position as a peer. So as a peer, I use my lived experience to help other folks with substance use disorder step into recovery and then thrive in recovery. And one of the biggest things I've learned, and one of my biggest beliefs in my position, is that everybody's recovery looks different. Yes, I had my own journey and I can use that to help others. However, I've been able to get exposed to so many different pathways. When I was at Homeward Alliance, I was serving obviously the primarily folks experiencing homelessness. I got to meet so many people in the field. I got to really be in like the hospice of addiction, right? Like a lot of folks who are on the streets have definitely entered the severe level of substance use disorder. And I got to see so much hard work and, quite frankly, miracles happen through the help of a lot of the organizations that are here today. It's really cool to see a lot of the CEOs, to be quite honest. So I start off over at Homeward Alliance, get to do amazing work there. I'm there for 1.5 years. And then I got connected with North Point Recovery Center over in Loveland. I did admissions there for a little while, so I was able to move from helping people get into things like treatment centers to actually being within one, and learned so much about what that process looks like from an admission standpoint. And now I'm in my current position as a recovery coach at Abundance Foundation. We're a nonprofit who helps folks get into sober livings. We have a women's sober living, and I'm in a really unique position where I'm able to take on my people, and we set up 90-day goals, and those goals range from getting documentation to going to the workforce center to start a career, to simply getting a car, to wanting to get into exercise. Really, I sit down with somebody and I'm like, what do you want to get done in these next 3 months? Even if you can't picture these things, right? Because all you know is addiction. What if you didn't deal with the demons that you had, what do you want to handle in 3 months? What's realistic? And we make it happen, man. And, I know in my journey, I don't want to talk about myself too much, but, well, I've been talking about myself this whole time, but I don't want to talk about...
That's what it's all about, yeah.
I don't want to talk about my story too much, right? Because this is about clients, but I needed to see, when I was in the pits of my addiction, I needed to see others who did my drug of choice and stayed clean, and I saw thriving and living fulfilled lives. I needed to see that firsthand, right? Like somebody else walked me through that process, and now I get to use my own journey to do the same thing. And I have so much respect for clinical work. I have so much respect for sober livings, and I'm really happy I get to play the role of being able to walk with someone hand in hand in all areas of life. It's so cool. It's a fairly new piece of behavioral health, and it's changed my life. My why is that it gives my journey meaning, and I get to see people change from the inside out and live self-directed lives. So, yeah.
Awesome. Thank you so much. Awesome. Misty.
Good morning. I'm Misty Perry. I am currently the clinical director at Larimer County Community Corrections. I started my journey, so when I first went to college, I was a business major, and I failed at that very badly. I would take accounting, fail it, take it again, fail it. And I decided, what am I doing? This is not me. And so I moved from my first college to my second, which was the University of Wyoming. And I thought, I want to work with people. I'd always wanted to work with people, but I chose to go the business route because I thought that's what my family wanted. So I ended up finding the social work department there, and they just had such an amazing passion and mission and what they wanted to do for the community. So that is where I started my journey. I graduated from the University of Wyoming. I'm sorry, CSU. I did graduate from CSU later, but, and then moved down here to Fort Collins, and I had some amazing experiences. I worked at the Namaqua Center, I don't know if people know what that is. It's a residential facility for children who are severely emotionally disturbed, and I did that for a couple of years, and it was probably what was the pivotal part in me knowing that I was doing what I wanted to do. Those little humans, I can't even tell you. So after that, I moved to Turning Point, which I'm sure many people in this room have worked there also, and I was there for several years. One of the people that inspired me was my boss, and I've sort of followed him throughout my career pathway until recently, and that's Mike Rettenberg. I don't know if any of you know him, but he was one of those people that guided me throughout my career. And so I did a bunch of stuff at Turning Point. I loved working with the juveniles. They were a ton of fun. I learned so much from them. And I ended up deciding I wanted to go back to grad school. And so I was lucky, and I was at my 7th year, so I got to fast track through the MSW program, which was amazing. And that's when I decided that I wanted to maybe take a chance at working with adults, because I'd never done that. And so I went to Community Corrections, and I was their first master's level intern there back in, 2007. And that experience just blew me away. I had no idea what I was walking into, and I had no idea that it was going to be my career path, to be honest. So after that, I stayed home. I had a child in the middle of my grad school year, so I stayed home for a while. And then Mike called me, and he said, hey, I have a job. It's part-time, and it's with this program called AIM. And it stands for Alternatives to Incarcerations for Individuals with Mental Health Needs. And it was through Touchstone, which is Summit Stone now, at the time, and it was a therapist position. And I thought, well, shoot, I'll go do this. I had never worked with anybody with SPMI. It was only addictions, and in particular, adults and then juveniles. So I took on this job, and I will tell you, the first 9 months, I wasn't quite sure I was gonna make it. It was the most trying yet rewarding job I had ever had. And these humans are the most resilient people on the face of the earth. So from that journey, I moved over to Community Corrections, and I've been there for 12 years. And that journey there, I love that organization. It's very interesting because every time I go and talk to social work classes, they're like, you work in the criminal justice system? And I'm like, 100% I do. What we do there is amazing. I've held multiple different positions, but now when Mike left last year, I took his job, so I've been in the clinical director role for a year. But I've supervised all the treatment programs there, and it really just has been meeting the clients, meeting their families, watching them grow and recover and have these beautiful lives, come back, give back, has been what inspires me the most. I wouldn't ask, like, I have my dream job now, which is crazy to think, but it's amazing. And I always challenge people, like, you know, criminal justice can be kind of an intimidating thing, and it's like, it's not lock people away and throw away the key anymore. It's like, let's get people better, and let's help them get better. So that's my journey so far.
Thank you so much, Misty. I'm a big criminal justice fan myself.
My name is Becky Wyperd, and I'm the Chief Clinical Officer at North Range Behavioral Health. Thank you, Allie. Yeah. She's partial because I paid her. Not really, not really. I am a native of Greeley. My family is from there, and so I'm born and raised and went to school there. And as I was deciding what I wanted to do, which we'll get an opportunity to dive into a little bit, in my master's program, I went to UNC. I had like 11 jobs. And how many of you in your master's program or any degree had 11 jobs while you were trying to? If you didn't, I'd like to know who you are. I tried all the jobs. I worked at our acute treatment unit. At North Range Behavioral Health, working with individuals who were struggling, adults at the time, and I worked for the police department and doing victim response for crime recovery survivors and walking with them through the court process. I was a substitute teacher. I worked for hospice, and I had all these jobs at the same time and no sleep. And really, at that point, I decided, what is it out of all of these opportunities that I've had makes the most sense for me? And I'm a relational human, and I believe in families, and people come with people at all ages, all stages, all circumstances. And so I decided I wanted to do family work. My master's degree is in marriage and family therapy, and I came to North Range in 2004, and I've been there ever since. I started with our MST program, supervising, doing in-home work, incredibly hard, restoring families and helping them find balance, and worked up through the ranks to now I'm the chief clinical officer. I've had the opportunity to work with our medical team, our adult continuum, and really, it's all about relationships and humanity. And I think anyone who chooses this field, yes, we're caregivers and helpers, but really it's about building humanity and capacity and resiliency. And I think people ask me all the time, why do you stay at North Range? I'm probably a lifer, and for good reason. Not that your organizations are not amazing, they absolutely are, but I had the opportunity to work underneath our tremendous and amazing executive director, Larry Podorf. And he just was a true beacon of you do what's right because it's right for the people, providing them the right service at the right time, and getting creative and never losing sight of the fact that people are hurt. And if there's a way for us to step and walk alongside, we'll do that. And it's just it's a gift and something that I don't take for granted. And I think I feel incredibly lucky that now I've been able to shift my partnership to Kim, and for her to carry that torch is just, that's my why, is the work that we do and the people that I get to work alongside. And I'm really excited about the impact that we get to make in the community.
That's awesome. Hold on to that microphone for a minute. We're going to start with you.
Okay.
I really appreciate all four of you taking a few minutes to share your why and to let us know about your work in the behavioral health field. We've got a couple questions to start us off with. And so while we're asking these questions, everyone's going to get a turn to answer. I would love for some of you folks in the audience to be thinking about a question or an idea that you would like to have our panelists talk about that might benefit you in understanding more about why a career in the behavioral health field is a really good choice. So let's start off with this question. What is the number one reason that you would encourage other people to choose a career in behavioral health?
I think my family thought I was going to be a reporter, and they for sure did. And I have three sisters. I'm the youngest of three, so I was questioning everything. I liked answers, knowing bits and pieces of information, and tried to fill in the gaps. I always, from a very young age, leaned into details and understanding. And so my family thought she's going to be a reporter. I wanted to be Vanna White, but that was not in the cards for me. North Range is almost like Wheel of Fortune. Just never know what you're going to get. Yeah. So from a young age, I was the watcher and the observer, and I think I didn't know what I wanted to do with that, and had a circumstance where my dad, I never saw him cry ever in my life, and he came home one day and just fell apart. He had come upon an accident where someone had died, and he was there, and they said, can you tell my loved ones this, this, and this, because that person knew they were, it was a fatal accident. And he fell apart, and I thought, what happens now? Who can help him? And so I have curiosity about stories, but really about taking it to the next level of what do we do with that? How do we help people connect and find resiliency and resources? Because he didn't ask for help. And I think at that moment it clicked for me that my interest in relationships and stories could be really helpful and useful in behavioral health and mental health and helping. I think that's something that as you think about, like, do I want to be a helper? Yes, there's a capacity to hold things, but really, do you have an interest in stories and seeing things? For me, it's very much, someone could say, hi, my dad's name is Dan. I'm Dan, and I own a Coors distributorship, and that's, my name and my occupation. But really, the interesting part is, do you like to know more than that? So for him, he is a man that grew up across the street from my mom. They were born just right across the street. They walked to school every day together, and eventually he would drive her to school, and then eventually they got married and they had 3 girls. And so those 3 girls rallied around him when he was at his lowest. So for me, if you have a desire to know more of what's underneath, to understand people's perspective and help weave humanity with resiliency and grace, just being able to hold space with people in that, I think that to me, relationships and knowing a little bit more to walk with someone along a journey when you can't necessarily see what's hurting. And it's just a tremendous honor, and I think, everyone should be in the behavioral health field.
Yeah, I love that. I love that. There's probably a lot of different analogies that we could use. When I was listening to you talk, I feel like it's like peeling back the layers of an onion, and I believe in the proverbial onion. At the core of every one of them is hurt and pain and trauma, and it's really about relationship and wrapping someone that has this hurt and pain and trauma in their life with relationship, right, and with support. And it's one of the most meaningful things that I've ever experienced. And I'm hearing the meaningfulness of a job when you can actually reach out and help somebody else. I think we can all identify with the appreciation that we've had for someone when we've been helped in our life. And so truly, being a helper in the field has a lot of deep meaning to it. So thanks for sharing that. Misty, do you have thoughts on that question? What would you encourage someone to think about a career in the behavioral health field?
Well, I think it takes a particular person in some capacity that wants to come into this field. However, I think that if you care about your community, there's a lot of things that you can do in behavioral health. And if wanting to have a healthy community and wanting your community to thrive, there's so many different things you can do in behavioral health. Yes, there's the caring side of it, but there's also the other pieces of it, like grant writing and policy and all these other things that I am not good at.
Stick around. There's going to be some breakout sessions on that exact session later on.
I have to do it now, but boy, oh boy, it is challenging. But those humans also are the ones that come into this field and get grants, so that right now, like our agency is providing scholarships for paid internships and CASs and all those things. Those are important humans also in the behavioral health field to then grow our behavioral health field. But I think that the people who work with the humans day in and day out, I think you come into this field because there's something that's within you that drives you to do it. I don't think just anybody can do our jobs either. I think you have to have a certain level of compassion and empathy and the ability to sometimes give your all when you probably should take care of yourself a little bit more. But I think there's so many pieces of that are part of what makes our profession so unique. You can't just walk in the door and work with somebody and just change their lives without experience, without knowledge, without all those character traits that we've talked about. So I think the coolest part for me is that there are a lot of different ways that you can get in it. And it doesn't have to be like this one pathway. I'm just a therapist. Like there's multiple ways that you can come into it. So that's why I would encourage people.
Wonderful. Thank you very much. Really, there is a breakout session later about the behind-the-scenes workers. It doesn't have to just to be on the front lines doing direct therapy and contact with the clients. It takes a whole team to really make the behavioral health world go around. So let's turn it back over to our panelists here to continue answering this question. And what would one thing that you would say to encourage somebody about a job in the behavioral health field, Terrell?
Okay. The biggest thing, and it's pretty simple, is the behavioral health field provides a space to learn that people change. And I think that's a really, really important thing to learn and see. It's not something that I necessarily believed in until I started working with multiple people in all sorts of situations. I also think it does take a certain type of person, and it's also something that I think everybody can relate to, right? Like we all know pain, we all know struggle, we all know confusion. We've all been in a place where we needed a hand up. Sometimes when I'm working in my job, and something that I tell people is like, I get home and I'm like, did I really just work though? Like it doesn't even feel like I worked. I just kind of like lived my life and do what I do, and I got paid for it. And
That's pretty cool.
it's pretty cool. It feels like I'm cheating sometimes. And I get this question sometimes, right? Like a lot of people who are interested, and I know for me, I used to think, I worked and then I enjoyed my life, right? Like it was two separate things. That's what I thought careers were about. And I think I live in a society, and I think we live in a society where oftentimes a lot of jobs aren't fulfilling. They're a means to an end. And in the behavioral health field, and in the coworkers that I come across and the colleagues, I find that that's just not the case. We get to blend the two, right? Our work can become our passion very quickly. So if anybody's thinking about getting in the behavioral health field, there's so many lessons to learn. There's so many beliefs that will be broken by seeing the power of people and being able to play a part in that change. It's a pretty cool thing being able to make a living from helping others. It's really a special field to be in. So, yeah, that's my
Thank
answer.
you. The behavioral health field is heavy, but it's also really fun and light. Who works in the behavioral health field now out there? Raise your hand. Do you ever have any fun?
Every day.
Thank you, Allie. I mean, it's heavy, but it still can be a lot of fun, right? It's important to have that balance. All right, Paul, share with us the one thing that you would say to encourage somebody about a job in the field.
I would encourage people to work in the behavioral health field for the number one reason, because it's needed. Needed badly. I was just looking at the 2021 data for suicide rates in the country, which continue to climb. And for 2021, Colorado was ranked 5th in the nation in suicide rates per 100,000 people, which is tragic. That's terrible. And working in behavioral health gives you an opportunity, particularly working in crisis, to prevent that, to save lives. And to save lives for the people who are sitting in front of you that are considering death by suicide. And in addition to that, maybe preventing the next school shooting or preventing the next mass shooting in a grocery store. And the trauma that goes along with that, with the community, with people's loved ones who have had to endure that. And I think it's very necessary work, and I think it's life-saving work. And I think that we have the opportunity to prevent a lot of tragedy and a lot of trauma in our community and our state and where we work and live, and the people that we care about who may be affected by these things too.
Awesome. Thank you. Hold on to that mic. If you're going to school at CSU and you're thinking about a job in behavioral health, as much as we would love for you to stick around this area in northern Colorado, because we're hiring all over in northern Colorado. Truth is that everywhere in the United States is hiring behavioral health. There's a shortage of behavioral health workers at all levels across the United States. So you really can take your game anywhere that you want to go, and you could find a career in the behavioral health field. So that's a pretty awesome opportunity. I want to ask another question. We'll start on this end and we'll work our way back down that way. Has anybody out there generated a question yet for our panel? You don't have to ask it right now. Is anybody working on generating a question for our panel? Cool. All right, thank you. All right, next question. What is one thing that you wish you knew before you got a job in the behavioral health field? One thing that you wish you knew in advance.
I think one thing I wish I knew before I began working in behavioral health is that a a lot of people don't want help. And particularly in the jobs that I've worked in, I mean, I'm working with a lot of people who are court ordered to do this or being taken to the emergency department against their will on a mental health hold. And I think that the fact that there's a lot of people who don't want help also makes the people who do want that help all the more rewarding to work with them. And I think additionally, when you have someone who's brought to, say, the emergency department against their will on a mental health hold because they were considering death by suicide and made some statements or threats that ended up with police or crisis being called and them being brought in, and they don't want the help and they don't think that they can get help and they don't think it can get better and they want nothing to do with this, and you're able to convince them that there is hope and that they can get help and it can get better, and get some buy-in from them in a situation that was initially very much against their will, that is really valuable, and I think that is very rewarding, and I wish I had known what that looked like earlier on, that everybody doesn't walk in, everyone who ends up in front of a mental health professional is not there because they want that help, but it doesn't mean that they can't be helped and still benefit from that process.
That's wonderful. Thank you. Terrell, back to you.
One thing I wish I knew is that I'm not that powerful. When I entered the field, I was going to change every life that I came in contact with, and I was going to change this entire field, which I think there's a positive way to think that way, and there's a harmful way to think that way. Yes, I can make an impact with everybody, right, by what I put out. However, I can't stop life from happening. I can't make nobody change. All I can do is provide the care that I've been taught to give and see what happens from there. I have seen clients get murdered. I've seen one of my clients get sentenced to years in prison. I've also seen clients get their kids back. I've also seen clients get off parole. I've seen clients get a car. I've seen clients get in their own apartment. I did not make any of those things happen. And that's what I mean by I'm not that powerful. I can just play a role. I don't know what part of my client's story I'm in. I don't know if I'm the peer that they think about who said one thing to them when they get out of prison. They think back to that one thing that I said. We haven't talked in years, right? And they're like, oh, that's what Terrell meant. And somehow that gets them to step back into recovery. I don't know. Or I can play the role in their life of seeing them change their life. I don't know when that's going to happen. I don't know if it'll ever happen. But it's about what I add. The rest is up to the client and whatever else is out there.
That's awesome.
Well, I won't say much more. I would agree with the two of you. I think the one thing I wished I would have known more was self-care. I think that goes along with everything that we do, but I think I went into this with like this Pollyanna thing, that same thing. I'm gonna go in and change all these people's lives, oh my gosh, and then when I didn't, the impact it had on me and my soul. And the importance of taking care of ourselves. When, I don't remember who said earlier that you should go to therapy yourself, but I think that wasn't something I was prepared for. In the very beginning, I was like, oh, I'm gonna go and do all these things and change the world. And yes, I am. And it might be in small increments, but it's also important that we all who are helping support these humans throughout their lives are taking care of ourselves too. I think that we all know that in this field, but when you first start, you have this like passion to just go out and do everything for everyone, and you forget to do it for yourself too. So I think that's probably something I would have went back and said, hey, Misty, you should probably take care of yourself a little bit better. So other than what you two said.
I would say something that I think I don't know if this is true for everyone, but I think that in my graduate program, we were taught sort of the fern and lamp way to practice, and managed care and billing strategies weren't really a huge part of that. And so when you step out into the real world, you're like, well, I'm a narrative therapist and I'm going to work with you, and it's very much not a linear process. So I think having an opportunity to connect around managed care and sort of having an understanding of different opportunities that were available to us to practice within, because private practice is probably a minority of the individuals practicing are in that capacity. And so I think for me, that's the piece I felt like I was missing, is all the funding mechanisms and managed care and restrictions and all of those pieces. I think I really, and I've given that feedback to the university of, hey, maybe throw a sprinkle of reality in there too.
Yep, that's great advice. If I were to impart a thought that I wish I knew before I entered the field, the word for me that comes up is the word gratifying. There is such a level of gratification, and maybe we've heard that in a lot of different ways. When I was working at the jail, I had an opportunity to write a short story, and it was published in a book called Serving Productive Time. And that book is shared in jails and prisons across the country. And every year I get a letter from an inmate, all over the place. Sometimes in California, Pelican Bay, like lifers in prison, but I'll get a letter from an inmate that says that they read that story that I had, that short little story. It was like a page and a half, and it was a compilation of a bunch of short stories. My short story was about me coming into the field, criminal justice at that point, but seeing the inmates in their cells when it was lockdown time, and most of the inmates were asleep. And they were asleep on their bunks, and they were usually curled up in a fetal position. And it hit me, it didn't just hit me, it struck me hard that these are mothers' sons and mothers' daughters, and these were babies. And they've grown up and they've taken a pathway that's gotten them to where they are today. And they've experienced something that probably none of us would ever wish on our worst enemy, right? They have experienced a trauma, and they are here because of decisions that were made, et cetera. But it was powerful to understand that they were humans and that they needed to be recognized and treated kindly and with respect. So the word gratification for me is, it just goes along with this field resoundingly, yeah. I want to pause there for a second on the questions that I have up here. I would love for us to, we do have a microphone over here. I don't know if it's working or not, but we do have one working mic for sure. Anybody interested in coming up and asking a question, or if you have a really loud voice and you want to just sit where you are and ask it, we could give that a try as well. Anybody? Thomas, be first for us. Come on. Sure. All right, cool.
Terrell, if I can ask you a direct question, what was your academic training background to get to where you were? And then I do have a follow-up.
Cool, thank you, Thomas.
Thank you for this question. This is something I wanted to touch on. None. High school diploma. I was working as a server, and an old friend of mine who I was actually in treatment with comes in, and she's like, hey, there's this position open, this peer position. I didn't know what peer work was. And of course I was like, I haven't been to college. I haven't had like a big boy job before. And she told me to still just apply. You know, it was a total shot in the dark, that I wasn't really even taking that seriously. And then I interviewed, and then of course I got my hopes up because I heard about what it was. Still had low expectations, and then I got hired, and I started a career and been able to get credentials as a certified peer and family support specialist and sit in rooms like this with like CEOs and stuff. So none, and that's something that I really wanted to mention, because I was not aware of the accessibility of this field. I thought that it would take years of education and all the things, and it does in certain positions, well deserved. However, my lived experience is what got me here. So if anybody wants to get in the behavioral health field and feels like they're not qualified, there is room for you, and you most certainly are.
I'm hearing that there might be opportunities to move up and move around once you get your foot in the door. Might that be true?
I'd say so. I'd say so. Yeah, I've been in 3 different positions. And the cool thing is, and I'm sure a lot of you who work in the field can relate, is networking just kind of comes with it. I talk to a new person almost every day in the field, so it's really easy to make connections. And yeah, it's very possible to move around.
Cool. You had a follow-up, Thomas. Go ahead.
You were training, or what, when you got the job, so you were getting paid, and then you got continued training through work, during work. I'm gonna put it up to the rest of the panel. While you're in school, or while you're in an internship or a practicum, how do you live? How do you make money to pay bills?
Well, with my credentials, I at Homer Alliance, I was so fortunate. They allowed me to take my classes while I was at work. So they supported new hires and they supported career advancement in such a major way, and that's not super rare. I know of a lot of places that do that. So I was able to do a 2-in-1. That's my story. I know y'all probably have very different ones. So.
I might be one of those people who didn't work, but not for an amazing reason. Part of the reason why I got the gift of not working was, long story short, both my parents passed away. And so I had money left over for school, and so that's what I did with it. My sister did not, and that's, we both had this pile. And so I said, I'm going to go and get my education, and that's what's important to me. And then I did that with my bachelor's, and then I went through and saved my money for my master's so I didn't have to work. But I worked in between all of them, but that was part of my journey, was that I was thankful and lucky enough in some capacities to be able to not have to work during those times, but that's why.
I'm not a very good example. I had 9 jobs. Yeah, it was 11.
Yeah.
Plus 9.
Plus
A
9.
lot. I did
That's
all
20.
the things. Yeah, I did all the things. I'm like, do you need help with that? I'd be happy to nanny anytime. And so, yeah, I went to school during the day, and then I worked swing shifts, so 3 to 11, and then I would hold call overnights for the police department. And I had a tremendous gift. My family, my aunts and uncles, I have many of them, chipped in and paid for my bachelor's degree. And that I recognize as a blessing. And for my master's degree, I took out a loan and continued to work and do all of those things. And then when I came to North Range, there was the opportunity to apply for National Health Service Corps, and now Colorado Health Service Corps. And I had a commitment to North Range for 2 years, and the federal government put $50,000 in my checking account. And so my master's degree was paid for in retro. And that to me is huge. We still use that as a benefit, as I'm sure all of you do, to know that if you go into this field and you do collect debt in that way as you're trying to divide your time and work, that there are scholarship and loan repayment opportunities available to you to be working in certain organizations and giving back in that way. So I did have many jobs, but I was a very thankful recipient of the National Health Service Corps.
That's a great input. Thank you. Paul, you have thoughts on that?
Yeah, so I'll talk about just my master's because I was a grown-up then and had to do stuff on my own. And when it came to that, I worked full-time for most of that, and I went to school 12 months, out of the year. So I was able to spread classes out more and take night classes and that kind of stuff to be able to accommodate working full-time and still paying rent. And I was, fortunate enough to have a wife who was also working and bringing in income. And eventually, I got to the point where when my internship rolled around, so I had classes, internship, and work, I was falling asleep standing up, and it was time to take out some loans so that I could simply focus on the internship and school and finish that process up, and then my internship turned right into a job, so I was immediately employed once I graduated with my master's degree, and then that's where I was able to get my hours to eventually go towards licensure. So.
Fascinating. Thanks for that question, Thomas. Yeah, you bet. Any other questions out there? Anybody's got a burning question? I have more up here. We're not out of questions, but I want to give you an opportunity if you have any. Allie, you got a question?
I do have a question.
Okay, go for it.
I would be interested, because you guys are all in a variety of different positions, which I think is awesome, but this year we really wanted to embrace seeing yourself in behavioral health. And one of the things as a recruiter that I love seeing is we are about ready to have access to this huge group of students and this huge group of talent that has grown up with sort of that wholeness of mental health and physical health being part of your day-to-day. And so for the first time, really ever, we are going to be able to bring people in who are going to know how important mental health is. And so I want to know how excited you guys are that that is coming and how much that re-inspires you to keep doing the work that you're doing right now.
Anybody excited about the future workforce coming? 100% is what I'm hearing.
We need people very much. And it is exciting to think that people want to continue to dedicate themselves and their careers to helping other people and helping our society and helping improve our society, because there's a lot going on out there that is really tragic and really hard, and it's not just the individual, it's the whole system that's being impacted by that. And we so many people are impacted by a family member who has significant mental health issues, or losing a family member to suicide, or experiencing the kind of stuff that's going on, and you have an opportunity to help, and that your willingness to help is very exciting, and for all of us, I think.
So we've got excitement up here from the health partners banner. It's a healthcare system, right? It's got a behavioral health component to it. From nonprofit in the community, from the criminal justice system, and from the actual behavioral health system itself. So there's excitement across systems for behavioral health work. You really have. In fact, I think there's a breakout session later on about the different places that you can do behavioral health. So if you're interested in learning about that, stick around. All right, what else we got? Terrell?
So if I'm understanding the question correctly, it sounds like responding to how we feel about this specific influx of folks who are going to be entering the field.
You got it, yeah.
I haven't worked in the field long enough, to see what the old was like. All I could talk about is my generation, right? I think that we're in a time, at least my generation, where fentanyl is such a problem. Mass shootings, which was mentioned earlier, is a huge problem. And because of things like that, mental health has been really stressed, like what was mentioned before. So I would say my generation is it's kind of in the mainstream to help oneself. Mental health is not as stigmatized. Substance use disorder is not as stigmatized. And I think that will really change the game once more of us are in this field. I think that, specifically with LGBTQ plus outlooks and stigmas, I think that will change a lot. I see a lot of marginalized groups coming to the surface and getting better care, as well as maybe a different outlook on passion, right? Because there will be a lot of lived experience, of course. I lean on that because lived experience is my thing. But I think each generation has its different flavor that it can add. And the world is crazy right now. And this generation has really had to internalize, and I would say that we've had to take a lot of matters into our own hands and advocate for our own mental health with the support of organizations like this. So I think that we'll be able to help folks take control of their own mental health and advocate for themselves as well, because we had to.
Awesome. Thank you so much. We are going to slowly wrap up this morning's panel from our folks. And I just have a couple minutes left, and I want 30 seconds or less from each one of you as we pass the microphone back down this way to close us out. Give us a few words, again, 30 seconds or less, about the favorite part of your job. I know we've probably beat this drum today. You know what a cool job it is, what a cool career it would be in behavioral health field. But from your perspective, where you're at North Range, at Community Corrections, the Abundance Foundation, and at Banner, what is the favorite part of your job? So start down there with Miss Becky.
So many things, but the favorite part of my job is honoring stories, celebrating resiliency, and busting stigma.
Awesome. Good stuff.
The favorite part of my job is working with the individuals that we change their lives, but also bringing people in. I love new blood and new ideas, and I get so excited and passionate about program development, and it just is one of those things that drives me every day about how can I do more and give back more, and how do I bring people into this so that they can have the same amount of passion that I have.
Thank you.
What comes to mind is breaking barriers, advocacy, fulfillment, and being a big mirror for folks to see the good in themselves.
Awesome. Paul, wrap us up. Favorite part of your job?
Saving lives and preventing tragedy and trauma from happening. Definitely my favorite part.
Awesome. Oh, Miss Carol's got a question. Can we have time for one more question, Miss Allie?
Make it fast.
Make it fast, Carol. All right, all right. You got it.
Becky and Misty and Terrell, thank you so much for the work that you do. Amazing work. And I didn't know you prior. And Paul, I am so grateful to have an opportunity to thank you publicly. When I was with Banner Health, one of the jobs that I did, apart from my real job, which I am a business person, was suicide sitting in the emergency department. And I got a chance to work with you, and I didn't recognize you when I walked in, but nobody worked harder to get placement for people that needed help. And the teams that work in emergency departments and work in all the fields that you do, nobody works harder than you. And I want to thank you all, and Paul specifically, thank you so much for the work that you do. You're amazing at what you do, so thank you.
Ugh. Thank you, Carol. Just made me all teary. Goodness gracious. That was very heartfelt. I appreciate that. I'm going to ask you to do one more round of applause for our panelists that made their way here today to share with you. So thank you all very much. It was wonderful to meet you. Great to see you again. Thank you.